So by way of disclosure, I do have individual product development agreements with the Pew Synthes, and we receive institutional support from multiple companies as outlined here. In terms of an overview for the talk, we're going to talk a little bit about the treatment approach for hip PGI, but really focus on the two-stage exchange. That'll be the theme of the next 4 talks. We'll talk a little bit about the different types of antibiotic-impregnated spacers that are out there. And then we'll focus for a minute or two on the antibiotics specifically that we're utilizing for these spacers. The bulk of the talk will be on showing my technique for the specific type of articulating antibiotic spacer that I use, the Prostalac, and then I'll show you a couple unique scenarios where you can apply some similar principles into some more difficult cases. In terms of the treatment approach for two-stage exchange, I think it's fair to say that remains the gold standard. How you approach the first stage can be variable. Certainly resection arthroplasty is a viable option in certain patients. You can use a non-articulating spacer or some form of an articulating spacer, of which there are multiple flavors. I think regardless of the approach that you take, the critical aspect is to perform a thorough debridement. That includes removing all infected material, including metal, plastic, sutures, dead bone, and infected tissue. So who do I use resection arthroplasty on as part of the first stage of an exchange? Well, I think in reality, these are patients that I think probably are going to be poor reimplantation candidates. So this is a patient of mine that I inherited very early on in my practice. He was a C3 host. He had multiple difficult to treat organisms. I did not think he was going to be a good reimplantation candidate, so I took everything out, didn't put anything in, and this was sort of the first stage of a two-stage exchange that never occurred. What about non-articulating spacers? Well, these are very good at delivering antibiotics into the wound, but they really provide patients with poor function during the treatment period. Their limbs short, they can't put weight on it.